they've done studies that like the human body can only withstand X amount of pain, but during childbirth, it's X amount of pain. And I'm like, did they do the initial study on men? Because clearly women can sustain more pain. That's what the standard is. Like in health, even like more men are diagnosed with sleep apnea, but women still have the symptoms of sleep apnea, but we just don't have as many apneic events, but we're not getting that like quality deep sleep the same way.
Hi, and welcome to episode 342 of the Untethered podcast. Today, we have my dear friend and colleague, Jeannie Nelson, joining us. Jeannie is the owner of Breathe, Eat, Sleep, Talk, and she is an ASHA certified speech language pathologist, born and raised in sunny Arizona, and communication has truly been in her blood from the start. She was inspired by her grandma, who is also a speech therapist, and by early experiences watching her aunt use sign language with her cousin with Down syndrome. Jeannie learned that communication is about so much more than words. It's about connection. Professionally, she is a lifelong learner with degrees from Arizona State University and Northern Arizona University, and she's earned the prestigious ASHA ACE Award for her dedication to continuing education. Through her private practice, she works with everyone from babies taking their first bites to adults navigating TMJ dysfunction and sleep apnea. And Jeannie brings a truly holistic approach to care, blending her expertise in myofunctional therapy, feeding therapy, speech sound disorders, and even craniosacral fascial therapy to help release restrictions and support optimal oral function. And as if that wasn't enough, she is also a certified birth doula who supports hypnobabies and hypnobirthing clients, weaving compassion and whole body wellness into everything she does. So please help me welcome Jeannie to the show. Let's jump in. Welcome to the Untethered podcast. I am your host, Hallie Bulkin. I'm a certified myofunctional therapist, feeding specialist, podcaster, business owner, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, airway, tethered oral tissue, and pediatric feeding therapy space. If you're new here, I challenge you to keep an open mind and join my mission to spread this message far and wide. If you've been around since June 2019, thanks for being a loyal listener. As we jump into today's episode, remember to listen with correct oral rest posture. Tongue up, lips closed, teeth apart, breathe through your nose. Let's get started. Jeannie, welcome to the podcast.
Hi.
I am excited to have you on here because I feel like we talk like all day long on social media. So it's fun to actually record together.
I agree. I have so much that we could talk about for sure.
Yes. And I know we do we have very similar backgrounds and the work that we do and everything. And I love that. But I also really love the fact that we're going to be going through our Marpe journeys simultaneously. And I think that was like really funny that we kind of figured that out. You're like, wait, you're going into Marpe, I'm going into Marpe. And I was like, wait, when are you doing it? So tell us, when are you getting your Marpe installed into your mouth?
Yes. So I'm also feeling so happy that I have someone to go through it with because it's kind of a terrifying procedure, especially because of all the things that we know. But my date is August 12th that I'm getting mine installed. So
yeah, and I'm August 11th. So we are literally like within 24 hours of each other.
Yes.
And I know we were talking a little bit before we hit record. So it'll be a little bit different too, which I think will be really cool. We'll have to like come back and do another episode once we're like further along in our journeys, or maybe after like we get the Marpes out of our mouth. I don't know. But I know that like I have this Piezo thing where like Dr. Koval is going to basically split my suture for me when, they're putting the Marpe in and everything. So I'm not going to like split on my own, which is the opposite of what you're doing. You're doing the procedure, which most people do, where they do the suture splits on its own, right?
Yes. Well, and I'm curious, and maybe you go into this, but talk to me about how she does that. Does she put you under for that? Is it just like local?
No, so I was just recording with her, like yesterday or 2 days ago. I don't even know what day it is anymore. Maybe it was yesterday. Oh my gosh. And so I asked her literally like 500 questions, which was really helpful to do on a podcast because I'm like, everybody actually has questions. And then I have questions. So let's cover all the bases. So you know what? I didn't ask her like what the tool is that she uses, but she even says, she's like, it's not a surgical procedure. Like, yes, it's procedure. It's in office. I think it's more of a like local anesthetic. Like I'm not under general anesthesia or anything. I think it's just they numb the area and that's that. So, but what she did show me is that based on the imagery that they take, they actually create a physical like printed guide that goes into my palate. So, and it shows them the exact line based on the imaging they took of
Wow.
like where they cut down the suture line. So that's how they know like where to split the palate. So I was like, okay, that's cool. Cause it's not like they're going in blind and just like, going down where they think the center of your palate is. Cause that would be probably really not a successful approach. And then they put the Marpe in, the mini screws and everything go in. I think I'm going to have, I think it's 6 mini screws in my palate. Is yours the same?
Yep. I believe mine's 6. Yep.
Yeah. Yes. Yeah. And then, I mean, so I think one of the big differences too, that I'm coming to learn from talking with others is because I'm having this piezo treatment done when my Marpe goes in, I can't use a Waterpik for the first week because there's some like tissue healing that has to happen. I don't start turning the appliance right away. I actually don't turn it until I think a week later. So I basically have to let my mouth like heal for a week before I physically start cranking things. And then another thing that's a bit different is she was saying that because I've had like the nasal surgery and they fixed my septum, plus I had the rhinoplasty, like I really don't want my nose to change, which obviously like the base of it might widen a little bit. But she said because of how the other facial bones shift and the skin kind of, moves and everything, she's like, my nose should not look any wider because I only need like 5 millimeters of growth, where most people need more. So she was like, if you needed more, that would be different. But because I've done other expansion in the past, I only need 5 millimeters. She's like, it's not a ton. And she said, I guess that with the appliance that she uses, you only get like 0.1 millimeter every time you turn it, whereas most are 0.2 or 0.25. So she said hers is like slower than I think some other Marpe appliances. And she's like, with me, she's like, we are going to like keep super close eye on it. And if we need to slow anything down even more, like we can do that so that it doesn't like disrupt my nose. I'm like, okay.
That's amazing. And so this is something you and I have talked about a little bit. My nose is actually something that has not been addressed yet. And we've talked about this because my nose is actually one of my biggest problems right now, and has been my whole life, and it's never been addressed. I know I have a severe deviated septum. I know there's lots of turbinates. My nose is a little asymmetrical. And then I notice things just because I'm in the myo space and because I'm me and looking in the mirror all the time. So I'm critical of that. But I'm in some ways hoping that it does kind of change my nose and the symmetry of my face. So that's another like different goal, I guess, that we have.
Yeah. Do you know how many millimeters you need of expansion or how much they're going for?
So I think he's going for like as much as possible. So my intramolar width is currently 27. So it's really narrow.
Yeah.
So
and so like he might be going for like what, 35 or, yeah.
So like I think as much as it allows. So I know he's going to be closely monitoring it too. But I think he's kind of going for as much as he can. Are you going for 35 too, or what is your end goal?
I don't even remember what my intramolar width is, but she basically was like, based on what I'm seeing, like she's like, you don't need more than 5 millimeters. So, and she was like, it could be 5 to 7, but like, I think we're going for 5. So I think I am like less than the average patient that comes in. But again, it's like I was standing with an SLP colleague who's not like in the myo space. We do like Pilates together the other day. And she's like, so why are you doing more expansion? Like, is it like, what is your goal? And I told her, I was like, my goals are one, ever since the nose surgery, I've had this post-nasal drip that has not left. And it's worse when I'm in recycled air. Like that is a big trigger for it. So if I'm sitting in a car, I'm on an airplane, like it just starts going. And my husband is like, you're making that schmarky sound. Like, why are you doing that? And I'm like, because there's literally stuff falling out of the back of my nose into my throat right now. Like I have to swallow it. Like it's I'm constantly like, it's like disgusting. I sound like a pig. So my part of me is like, I don't know what it is. I don't know if something in like the nasal surgery, like something sitting somewhere different, something got triggered. I don't know like what, maybe it's just stimulating something to produce extra. So, I don't know. So it's so strange. If I use Clear, the nasal spray, then I feel like it does help it a bit, but it feels like more of a Band-Aid than a long-term, solution. And so one of my in my head, and I'm like, I've totally made this up. This is not something that like has been promised to me, of course. But I'm like, in my head, I'm like, if I get that 5 more millimeters of expansion, it's going to change some things in the nasopharynx. And hopefully whatever is triggering that to happen leads to it stopping. Like my goal is like for that to stop. Now, I'm like, I know there's no magic wand. We don't know if that'll actually happen, but I'm really hopeful that it will.
Yes.
And then secondly, there's 3 things. So that's one. The second one is I've been waking up with a scalloped tongue quite a bit over the past like year or so. And I'm like, I feel like I have enough room for my tongue and my palate. Like I don't have that overflow when I suction my tongue because of like the DNA vivos and everything. But for whatever reason, I just feel like things are not sitting where they're supposed to be. And part of that is my maxilla on the upper left side is turned inwards a little bit. And so what that I think is doing is causing asymmetry. So I'd love for those asymmetries like to be addressed and fixed. And she says that will absolutely, like that is the plan. And then the third thing is, well, and it's directly related to that, but I started to wake up and I had a couple times where I woke up and I like could not open my jaw and I felt like pain and discomfort in the left like temporomandibular joint area, really more the muscles than the joint itself.
Yes.
And it's crazy because if you watch me talk, everyone's like, oh, your jaw deviates to the left.
Mm-hmm.
What we realized is it's not, and I realized this when I was doing the DNA vivos with Manny, who was doing the PT, doing all the body work with me. We realized it's not my mandible that's off. It's my mandible is actually centered. It's deviating because of what's happening with my maxilla. So it's compensatory and like secondary to what's happening with the maxilla. And the vivos just was not strong enough to open the suture and actually like get us what we needed to do to unlock the maxilla. Because we tried like through body work plus the appliance, all the things. So that is a big goal for me is to like unlock the maxilla. Obviously, we'll be able to separate the 2 sides of the palate. And then when everything like heals, like have it heal in the right place, have it, so fix all those issues. Yeah. So I don't know. For me, that's the big thing. I do feel like it's so crazy to watch me talk because like the asymmetries that happen are totally a result of this like maxillary bone on the left side. And it's wild. Yeah.
It's so interesting. Well, and I think one big thing with all of this, and like along with what you're saying, like I can so relate to the reasoning for it because it's similar but like slightly different. But I think a lot of people say that to you, like, why are you doing that again to yourself? Like, and my orthodontist, so this might differ from yours too. He's actually doing braces on me at the same time.
Mm-hmm.
And I have hesitations about that because I've actually had braces 3 other times in my life. So I'm not looking forward to it. I think you and I are also exactly the same age. So I turned 40 in like a week, or no, less than a week. It's August 4th. So really soon.
So soon. Happy early birthday.
Thanks. But being like almost 40 and thinking about going back into braces is like not fun. And I'm definitely dreading it. However, I'm trusting this orthodontist because of his knowledge and like how he does things. And his reasoning for doing that at the same time is to help with aesthetics and then also to just kind of do 2 things at the same time. So it's not, so it is providing all the growth that I can get. So like not just teeth tilting, like, but also getting, the bone to grow too. So, but I get that question a lot where people are like, why are you doing that to yourself? Like your smile looks fine. Your teeth look straight. And it's like, orthodontics is so much more than just straight teeth. Yes. And I think being in this space, we also know super well that like, this is also so much more than just the muscle because of habits that we've had in our whole life. So up until we were 40, all the things that we did for so long before we got into the myospace, before we understood how the bones focus on the muscles and how all of that works. So how the muscles influence the bone and how they shape. I also had expansion as a child. I don't know if you had that.
I did expansion and braces and then permanent retainers. Yep. All the things.
So did you have headgear though? That's the one I have.
I did not have headgear. No. So there was no retraction or anything or protrusion, like I didn't have either, or I just had the rapid paddle expander followed by braces, went into upper and lower permanent retainers that were supposed to fall off by the time I was 20. They didn't. I had them taken out at 30 and everything started to shift. And then I learned through Myo why that was happening.
Right. Yes.
Yeah.
Okay.
Yeah.
So yeah, it's the same. I had an expander actually pretty young for back in the day, but when I was 7 was when I started my whole orthodontics journey. So I had
Oh,
expansion and braces just on the first front, on the top front 4 teeth, and then had to have it again in middle school and then again in college. So here I am 20 years later getting it again. So
gotta love it. Gotta love it.
yes.
Yeah, so I'm not gonna have braces, but I am gonna have and it's kind of like Invisalign, but they actually they print their own. So she uses Invisalign, but she also has something where she can print her own clear aligners. And so for her Marpe cases, she uses her like own clear aligners. And so I was asking her about this when we recorded because I was like, well, tell me the timeline again. So do your braces, before I talk about that, do your braces go on like right away, or do you like get the Marpe first and then the braces go on like at a certain point?
So to my understanding, they're going on at the same time.
Oh,
Um,
wow.
I
That's a
know.
whole lot of fun.
It's a whole lot of fun. I'm definitely like hoping that this goes as quickly as possible. Do you have an estimate for was because I don't have an exact timeline either, and I think because of my profession, because of how much I talk to this orthodontist, we're doing it like together, kind of as a case study. Like what can we do to like help balance your teeth and your jaw and like to make things more optimal. But yeah, so I'm not sure.
I mean, I've seen other people go into Marpe and braces and they still have the Marpe in their mouth when the braces go in. I don't know at what point like they got the braces, if it was right away, if it was later on. So that's why I was curious. But so my timeline looks like this. So I get the Marpe August 11th. And then I think what she said was like, we turn it for however long we turn it. And it was maybe, was it 6 to 8 weeks maybe,
Okay.
that we're turning it. It's like once a day unless we slow it down for whatever reason because of my nose. And then she was saying that at that point, when I'm done turning it, what they do is they take off the arms that are like connected to the teeth, but they leave the center of the appliance in, because she said it takes probably, I think it was like upwards of 8-ish months, and I'm totally misquoting the time frame. It was maybe 8 to 10 months for the growth that you had to fully fuse, heal, all the things, right?
Right. Yeah.
So they'll leave that in for another 8 to 10 months. But as soon as the arms come off, they move me into the clear aligners. And then what she does from the gaps that have been created in the teeth is she moves everything forward tooth by tooth with the aligners. So she will move like my central, like upper central incisors like closer together than the next teeth and the next teeth and the next teeth, which I think is really cool because when I did DNA Vivos, I went into Invisalign afterwards, and and I didn't have to. It was more for cosmetic reasons. And what ended up happening was I did lose some of my expansion in closing the gaps because just the way that I guess the Invisalign did it, it kind of retracted me a little bit, maybe not all the way, but like enough that I could feel that I lost tongue space. And whether that was just tooth tipping that then got, was kind of tipped out and got pulled back or whatever it may have been. I don't know. Do I feel like my palate is more expanded from the DNA Vivos and that I got like real skeletal expansion? I do. And my imaging suggests that as well. I don't think my current ortho feels like that is possible with that appliance. So, like she's not like saying that outright, but that's kind of like read between the lines. Really feels like it's more of a tooth tipping appliance. So, did I get the same kind of expansion that I think I'm going to get with this? No, absolutely not, because you're splitting a suture. So like, hi, that's a totally different ball game. So part of me was like, I want to know, and that's why I asked a lot of questions about like, well, how do we move the teeth, and will I get retraction? And so she'll put me into upper and lower. She's actually going to start the lower. I keep calling it Invisalign, but it's their plastic. Not plastic, but they're printed aligners. She'll start me in that right away, the bottom one. So the bottom one will go in as soon as the Marpe goes in, but the top one will go in until the arms come off, like probably 8 to 10-ish weeks into the appliance being in my mouth. And then the clear aligners, I think it's basically a 2-year process all in.
Right.
Yeah. Which is what it was with like the DNA Vivos. And then I had another year of Invisalign. So that was like a 3-year process.
It's a lot. I mean, this is why we say it's a journey, right? Like, it's not just a quick procedure. Just like when we talk about tongue tie releases, it's not just one thing that you're doing to change the structures. It's a process, because our bodies are slowly changing and adapting always to the structures. it makes sense that it takes a while to do that.
Totally.
So similar, I think, though, is I think that's kind of the reasoning for putting the braces in at the same time, is I think, as kind of like what you were saying your orthodontist is doing, as my jaw is growing, he's going to change each tooth, I think, as it's going. So I'll never have the big gap that I think you'll have. Is I
Interesting.
think
Okay.
I know. So I'll have braces. So that's a whole. I mean,
Well, you know what she does and she offers, which I don't think I'm going to have her do because part of me just wants to document this without it, but she will offer to put what's it, not enamel, or it's enamel, but like they will do that while you have the gap for her clients. So she's like, if you don't want people to be like, why does your mouth look like that? Or you're like a business person, or you're, you know, whatever, like whatever your reasoning is, they offer to put the composite or the enamel or whatever it is like on, and then they shave it down as the teeth like move closer together, when the gap's closing and everything. And I was like, that's actually, I mean, in both where I live, I feel like that's like, you know, you want to get people to do this. Now, a lot of people coming to her holistic and probably also don't care, but you know, there's definitely people I think who would feel better about not having the gap, right?
The gap is a big thing. I mean, so I actually, interestingly enough, had a gap as a child and felt very self-conscious about it. And then that's why I got the braces so early. So like when I was like 7 or 8, because I had a big gap and I didn't want it. So, you know, that's another like just area that you'll remember those things, you know. So like I think as an adult too, all of us have some level of, we want to look nice and good, and like we don't want to look aesthetically like a certain way. So that makes sense. But that's nice that she does that. I think that seems like a nice little like.
Yeah. And I also said to them, like when they were initially telling me, I was like, well, I'm not going to say no, I definitely don't want it. I'll see how I feel like in the moment. I was like, but part of me is like thinking no, because I want to document this journey. And I feel like to document it for others, like in the Myo membership or in the Myo, you know, whatever, I feel like it's helpful for people to see like what it's going to look like for most people, right? And not like Hallie getting a little pretty thing added to hide the gap, you know? So.
Yes, I know, right? Yes.
But they'll do it like as part, like they don't charge extra. Like they do it as part of the treatment if you want it. It's like kind of built in, which I'm like,
that's really nice. I feel
isn't
like
that nice?
I feel like lots of people would be interested in that. I think that sounds
for sure. Yeah. And I asked her too, because I was like, did you do it? And because she still has like a tiny little gap, and she's like, no, I didn't do it. Because she's in it herself, my ortho. So she had, she didn't obviously, you know, put it in her own mouth. She had somebody else do it for her. But she's like been kind of and she's had lots and lots of cases, but she's been like testing out like certain things, I think, on herself too. Her kids have had expansion with her. So, you know, she basically is very gung-ho myo. Like you do the Marpe and the myo, you do the expansion and the myo for the kids that don't need Marpe yet. They, you know, my kids are in an expander with her right now, and they've had all the like little spaces between their teeth, and I will tell you their like smiles are so wide, and it's like the best expansion that they've had. So I'm like super happy about it. But yeah, it's just wild. I'm like, I can't believe I'm doing this.
Same. Okay, well, so on that note, because I can't believe I'm doing this either. Like it feels surreal that it's coming up so soon too, because it's like 2 weeks away.
I know.
What is your biggest fear with it? Because I have like lots of fears and I'm very terrified, but what's your biggest fear and feelings around it?
So I asked her outright. I have a high tolerance for pain. So I think for most people, they're worried about the pain, the discomfort. And I'm just kind of like, I'm going to Netflix and chill for a week. Yeah. I mean, not really. Like I will work on things that don't require me to speak. So I will be working, but like behind the scenes stuff. Yes. And I'll come on and talk so everyone can hear my speech on social media, right? But I'm like, I'm not recording anything in the business. So I just came back from being away for 3 weeks, and basically before I left and now like this week have just like had a ton of recordings for the podcast, because I'm like, I'm worried I'm going to sound so slushy. And, you know, it's one thing, like I don't think people that know me are going to care. But like, if you're new to my podcast and I'm a speech pathologist who has slushy, hard to understand speech, and I'm a host of a podcast, like, well, that's interesting. Right. So I said to her, I was like, be realistic with me. Like, when do you think I can speak with enough clarity that it might not sound like me, but it's enough, like it's clear. My speech is clear. It might sound like there's something in my mouth, but my speech doesn't sound like slushy, jarbled, whatever. And like solid for a recording. If I'm recording a new course, or I'm recording a podcast, or I'm doing my Feed the Peds launch. And she was like, give it 30 days. And I was like, okay.
Oh, wow.
So, I mean, it is a long time. And I honestly I'm using that time to focus on other things. So, we kind of have pre-recorded a whole bunch of stuff to carry me through September, even part of October. But I have a Feed the Peds launch that starts. I'm going live to do a live training on September 8th. So I'm that is exactly a month from when I'm getting it. And I have to talk for 3 days straight. And I'm I don't know how that's going to go, but here we go. I mean, obviously I'll be starting that training by being hey guys, I have a big old appliance in my mouth. So if I don't sound like I normally do, which you might not know, because maybe you're new here, just a little side note, that's why I sound weird. I don't know. How about you?
It makes sense to that. Well, so I'm obviously concerned about that too, because I'm not, a podcast host, but my job is
You're a speech pathologist.
helping children speak. And I definitely have that same concern. I am actually working that Thursday. So I'm getting it on Tuesday and I'm working on Thursday, which we'll see how it goes. Same thing. I'm going to tell people, this is how I sound right now. It's not going to be permanent. I'm sure, and I don't know if I'm alone in this, and I wonder if other speech pathologists listings can relate. But when I get certain children that are working on sounds in certain ways, I lie in bed and try to replicate what they're doing. I don't know if that's just me being a dork.
Yeah, no. So that way you can kind of advise them on what they should be doing instead and trying to get why they're doing what. Yeah, totally.
Right. So I've even tried to replicate in my own speech, okay, so when I have a Marpe, I'm not going to be able to touch the top. So my the mid tongue is not going to be able to touch all at the top. So it's going to sound kind of like this. And how can I flatten out my tongue to make it sound better? And I don't know, I play with it. And so of course, when we have the Marpe, I'm probably going to be doing some exercises to just practice. I'm sure you will as well.
Yeah.
But in my head, I'm constantly thinking that this is going to be, a short few steps back for long-term gains. And
Yes.
this is going to buy, even if it's in for a couple of years with braces and stuff, that this is going to buy health in the long run, and really help in exponential ways. Another thing that we haven't really talked about yet, but one of my big reasons for doing this, not only is my palate is so small, but my airway is so small. And I've been a lifelong mouth breather. I've done a lot of work with the myo portions, with my muscles, with so many things for my kids. But Marpe especially, I know, is going to just change the structure to allow my muscles to sit better, to work better, to help me breathe better night and day. And I do have OSA, so I do have sleep apnea. I'm not using I'm blanking on what it's called. The
a sleep apnea machine. Yeah. CPAP. I'm why can't I think of the word?
I'm people use this all the why can't we think of that word?
Sleep apnea machine. I had to circle more cute to get the actual term. Yeah, it's okay.
Yes, so CPAP. I'm not on a CPAP, but I do all the things at night. Currently, my nightly routine is I do the clear in my nose. I do intake breathing strips so my nose is wider. I do this whole breathing routine. And then I mouth tape with the myo tape around my mouth. But I'd say 5 nights out of 7, I rip it off. And it's just because I simply cannot get enough air. And I know it starts in my nose and where it is. So I'm really excited to have more room in my nose, to have more room for my tongue. That's another thing that I think I probably hyper focus on as a speech pathologist and a feeding therapist. But the way I chew and swallow, my swallow reflex is triggered quicker because I don't have this room in my palate. And again, I think some people probably couldn't articulate that, but I know that I pocket food. I know food gets pushed back quicker than it should. And maybe I'm making that up, but I feel that has to be related, right? If you have more space, you have more room to chew, you have more room to hold on to the food and to chew it versus just controlling it back. I'm right. Yeah. So, and obviously I accommodate with no bites and cutting up food and trying to take my time. But at some point your body takes over and it's just nope, we're just going to swallow it down.
Yeah.
So, yeah.
It'll be interesting to hear how things are going. Obviously, I feel that's not something you're going to really know until it comes out and you can actually swallow without a big appliance in your mouth again.
Right.
But speaking to the airway, actually my airway, and it's I forget this, which is kind of funny, not funny. Parts of my airway are okay and other parts are looking very narrow. And that was also why she was like, yes, you can totally benefit. And I do recommend that you have more expansion, right? Like that's another reason. So I should probably add that into my list. It's funny until you said that I hadn't thought about it. But she and I talked about it when we were recording, and she was saying how like a lot of us are so hyper focused on like the AP, like anterior posterior growth and getting the jaws forward. And she's like, that is important. She's like, but she's like, the research even is just showing that like lateral growth, right, of like the expansion of the palate opens the airway so much more. And so that's like super, super critical. It's all important, but I think it's very interesting because she was talking about like the different, planes and everything, and how we really want to focus, on not just the AP, which I think there's so much talk about right now, but also on like the sagittal plane, which is kind of like that, the side to side.
Well, that makes sense to me for chewing and swallowing more than, which I think is kind of what you're getting to. Like, I think that makes more sense to me, or even from the myo perspective, when we're giving exercises to widen, narrow the tongue or lateralize the tongue, we need that width. And I can also relate to that. And you talked about scalloping too. I definitely get tongue scalloping, and I almost feel like it's unavoidable. Like no matter how much I work the muscles, no matter how much I work my tongue, like my tongue is in great shape. Like my tongue is doing awesome, but I cannot get the space that I need with the way it's sitting.
Well, and that's like airway, right? It's like airway, tongue space, like all the things. And like to your point, right? So like if we're looking at it like the sagittal, like kind of left to right or whatever, the tongue, like protrusion and retraction, we talk a lot about that. I do feel like the width impacts that. So even though that might be like an AP movement, like it totally impacts our ability to move our tongue. Like when we're doing any tongue grooving, and when you're trying, like you were talking about it impacting your swallow, when we're kind of grooving the tongue a little bit and shaping it to the palate to swallow food back, like we need that lateral growth in order to get the tongue where it needs to be. So anyways, I feel like it also impacts like how we open and close our jaw, and how, even our soft palate, I think also is then impacted on like the elevation and depression of the soft palate, which I think for us SLPs, it's always interesting to like hear how people say certain sounds like in the back of the throat, right? Like the and unga. It's interesting because it took me a long time as a newer myotherapist to like hear people say that and start to hear the difference between how people were producing it, and be like, I don't know if they're like moving their velum like the way they should be able to. And is it a tongue issue? Is it a velum issue? Like, I don't know. But for the soft palate, we know it has to move to close off the nasopharynx to produce certain sounds. And I do think for a lot of us, like that also is impacted. So it's very interesting when you start to like look at, like you task analyze, right? And you look at all these different things broken down, and how just like one seemingly small issue seems to impact so much.
Yeah. And the maxillary bone too, I think is something that we talk about a lot, but I'm also curious if it'll impact even vision things. So, because that's something that we don't talk about so much when we're talking about the mouths and we're talking about the nose, but the maxillary bone, goes right under your eye socket. So like, one thing that I have is I have double vision. So I have to have a prism in my glasses. So I can't even wear, contacts because of the way my vision is. And I have done some vision therapy. I've kind of paused that for a moment just because of the time commitment. I mean, it's like
all the changes. Yeah.
So much. And then also with this, I'm wondering how that's going to change things, because we're really moving like, cranial bones here. So how is that going to impact how my eyes sit, how we exercise our eyes too. So that's another one that I'm curious about.
Dr. Koval was actually talking about that when we recorded. So she was mentioning that like she sees changes in people's eyes because of the sutures between, the maxilla, the mid-palatal, just all the mid-palatal suture, obviously. What else was she talking about? She was talking about, like you were talking about the like the orbits, of our eye, nasal cavity, all the things, right? So she basically was saying that like it is so anatomically close, but also when like these sutures, here shift, there's sutures also here. And she's like, she sees like the eyes, I don't want to say get wider necessarily, but I do feel like there's like expansion, like the face changes. And if you look at people that have had Marpe,
Yeah.
sometimes their eyes look more open, like they look brighter, more awake, so I've definitely seen, like when you look at pictures, I've seen changes. And I do feel like I don't know if she was alluding to it or if she outright said it, but I think she was saying like they do see like growth there as well and like shifting, but in a good way. You know what I mean? Like, and through like that cheekbone area. And that's where you see people get like better development of the bones in their face. It almost looks like they all of a sudden have like more definition, which I did get. I got that when I did my Vivos DNA. Like I developed cheekbones that I did not have before. So I'm like, ooh, am I going to get more cheekbone? Like,
That's nice. Yeah, no, I'm excited about all of it. Like just all the changes I think will be positive.
Yeah.
Even though, like we said, the journey is a few steps back to get the ultimate goal, but I'm
Yeah.
excited.
I remember what she was saying, actually. She was talking about how like because we always talk about the floor of our nose being like the roof of the mouth. She was talking about how like the floor of the orbit, like the eye socket, area, maybe it's not eye socket, that might be the right term or whatever, but is formed by like the roof of the maxillary sinus. So that's what it was. And so that's where she was saying that you can definitely get the changes because of just like you're talking about, like the shifting and the sutures, like everything is so fluid. And I think a lot of people think that everything is super fused in adults. And she's like, no, everything is still so fluid. And those sutures, we have different sutures in the cranial bones and things shift. And I'm like, it's kind of cool. So it'll be cool to see like if like the width, like the orbital width changes, or if it changes how you're seeing things. I'm like so curious about this now.
I know, right? There's so much to it, and like it's going to be so fascinating. I'm looking forward to just like really having like it's like a study buddy, but like having like a partner like doing this. It relieves a lot of my nerves because I just feel like it is a terrifying procedure to go through. But I have so many hopes for big changes with it. I think it's really going to be impactful.
Yeah, there is somebody that I have known through the Myo world who just got her Marpe put in this past week. And so like she was like talking about it, and I think she didn't have it split with like the piezo like I'm having. It's more I think like yours, and I think she'll also probably do the braces, but I don't think she went right into braces right away. I could be wrong. But anyways, she was like talking about, it just feels like a lot of pressure because the suture hasn't split yet and all of that. And so I think it'll be cool for us to like compare what that feels like, looks like, since that part's definitely different. And then, we'll just, I don't know, but I feel like we need to like create something where we can like document daily. So we have like these interesting comparisons to, because when I did my nasal procedure, I was just keeping a list of like signs and symptoms every day and like how things were changing. And I just was taking photos as well to like document. And then I did a training on it in the membership where I was like, okay, this is basically, the first 60, 90, whatever it was, days, post-op, which was interesting. But I feel like if I had something like that to watch right now, like for somebody's Marpe journey, I think I would feel like 100 times better after talking to her yesterday, but I'm still like, it's the unknown of a procedure and something going into my mouth. And like you talked about, like for our work, like we need to be able to speak. So there's that.
Yes. Yeah. It's going to be interesting. My hope is that like, that because of our work, it can be like a hope for other people going through these things. Like, so even if they're not doing this as their profession, just to say like, okay, if she does it as her profession, obviously there's some truth behind this. Obviously this is a good way to like to move bone, to shift bone, and also to like have big impact on function and just how just the structures can change the function, especially when you address the function from a muscular standpoint in therapy and then moving it and shifting it with the bone, with the structures. So I'm hoping that it's just like a goal for other people to be like, wow, like look what that did and like how it impacted and how it helped.
And if nothing else, you'll be able to relate better to some of your little speech kiddos, and they're going to think it's hilarious that, Miss Jeannie can't talk well, and, maybe they can be the therapist for you. We'll see.
Right. That's always a fun game to play in therapy, right?
Yeah. Hey, can you tell me how you do that? Because I can't put my tongue up there. So how do you make that sound so well?
Right.
What's your strategy?
Right.
Oh my gosh.
It's going to be so interesting. Well,
are you like ready for the food part of it? Because I'm like, I don't even know what I'm gonna eat in the first week.
so I literally was just having a conversation with ChatGPT about this, about like pureed soft solid foods that are going to be comfortable for that. This weekend, I'm planning on making some soups. It's really hot here, and I know it's hot where you are too. I'm in
Yeah.
Phoenix, Arizona, so it's pretty hot here.
Yeah.
Um, but I'm thinking of making some like soups. I'm thinking smoothies. I'm thinking, just like that's my plan at least for the first like week or so while I'm
Yeah.
so tender because I'm really nervous about the tender part. But and you've touched on this too. I have a pretty high tolerance for pain. I've done 2 unmedicated childbirths, so I'm like I think I can handle anything at this point. However,
Totally.
it's just the pain doesn't seem fun. Like it seems really hard. But so I have like a little list. So I'll have to share it with you what I found. But ChatGPT
Amazing.
was helpful with that. But yeah, what and did your doctor talk to you about how long you accommodate food things? Because I mean, the other thing is, again, having braces 3 times, I'm very familiar with foods you can and can't eat with braces. I mean,
Right. You've got braces.
it's
Yeah.
been like 20 years since I've had braces, but I know so many things can get stuck and like, can change the way things move in your mouth. But
I'm like
I'm
looking
also,
at my notes as you're asking me that because I'm like, I
yeah,
feel like I wrote something down somewhere because I had some ideas and now I'm not seeing any of my ideas here. I think I like crumpled them up. But anywho, so because of the piezo and like I can't use the
right.
Waterpik for the first week. So like
Yeah,
I don't want to eat anything that's going to get stuck up there. And so she was suggesting to me, like, especially in the beginning, like avoid things that are more acidic, avoid like if you're going to eat fruits, make sure it's not like a pineapple or something that's going to have like, it's going to be stringy because like you can't, it's, she said for her, it was like the hardest thing was like being a dentist and wanting to be able to like floss your teeth and like you like literally you can't floss like you can't get the floss up there and with braces like you're going to be able to floss between some of your teeth but the area where like the brackets are around your teeth for the Marpe like that's she's like and I actually have this is one thing that I'm like think will drive me crazy. I have like a pocket where I've now had a filling on my back tooth and there's like a pocket between the teeth and so I'm constantly having to like pull food out of it like no matter like what I eat and so I'm like oh my gosh like I don't think this is going to fill that so like how am I going to like this and it sometimes it's like uncomfortable so I'm like how am I going to get this out and I try to keep it so clean so I don't have that issue and I'm like well maybe they'll put a bracket around it and like fill it with something that'll like close that space I don't know I have to like tell her about that but I'm like, she's like, one thing she told me was she keeps like a soft toothbrush with her and like a travel one that's like got like toothpaste on it or whatever. You don't have to like carry toothpaste. And so she's like, she'll open that and it's like baby soft, like super soft. And she'll just kind of go in after she eats and just like lightly brush the appliance and everything to kind of just keep it clean and make it feel like, like, cause you're probably not going to be walking around the Waterpik all the time. Right. So if you're home or you're at work, maybe you have it with you, but like if you're out at a restaurant and you're like, oh my God, this is driving me crazy. Like when you whip a Waterpik out of your purse, I don't know. They do have, they have the ones you can travel with, but are you going to do that in a public bathroom? No. Yeah. But I do feel like it's more common that people will like pull out a toothbrush and like brush their teeth in a public bathroom. So she's like, you do that. And it's kind of like a throwaway thing. So I was like, that's an idea. Like I hadn't really thought about that, but that's just the biggest thing is like, I know my kids like they didn't have Marpe, but they had rapid palate expanders with her. And at first it was so close to the top of their palates, even though their palates were high, that it was like, and theirs has like, they have like a modified Haas. So there's like material, there's like the plastic or whatever it is on it in addition to the metal. And so things would get super stuck. And we were using like some of those, little bendable thingies that you can stick between your teeth or between the palate to like remove the food. But I'm going to have an open, like I think it'll be open down my suture line at first. And I'm like, I don't want to be sticking anything up there. So I don't know. That's the one thing where I'm like, I don't really, she was like saying salt rinses for me will be really helpful for that and keeping that clean. And so, yeah, I don't know. I'm like, I just got back from Italy. I think I gained 7 pounds. We're just going to go on a liquid puree diet for at least a week and we'll see what happens from there.
Yeah, that's pretty much my plan for a little bit. But especially with that suture ahead of time, I feel like you really have to be, especially with like acidic things, because that would hurt with an open wound. So I'm wondering with mine though, like eventually there's going to be an open wound, right? Or no? Like when it does
I
split?
don't think so because I don't think the skin ever like gets cut. I think the skin just kind of stretches, right? So I think it's like the skin is still there. So even though the bone may be moving apart,
Skin
I
is still
think that it's never like an open wound, if you will. And I think that's maybe the one difference. And I mean, the mouth heals so fast, so I think it's going to be totally fine. But
yeah.
I'm like, I'm still a little unsure about like what that looks like, and like, I'm like, am I going to have a hole in my mouth? Like, what? I don't know, because I think if they go through and they do split it, I don't think it creates it's not like it creates a big gap from the beginning. So I think everything's still like kind of like very close together, and it's just a matter of the skin healing, and then we start cranking the appliance to move the bone.
The
So
bone. Yeah. Yeah.
yeah,
Do you have bodywork plans like while you're on this journey pre and post? Like what is your plan with like
I
no?
need to. I haven't done it yet.
Okay, well, so one thing that's different about my practice is I also do craniosacral fascial therapy and
Mm-hmm.
then manual therapy as it relates to the structures of the mouth, face, jaw.
Yeah.
And so that's something that I have been prepping myself for. So I've been doing some CFT sessions, not on myself, like I
Yeah.
have
Yeah.
someone who's doing it for me, chiropractic work. The day after I get my Marpe, I'm getting a lymphatic massage.
Mm,
So I'm planning on doing that just because I'm not working that day and I'm like, I'm just going to rest
that's a good
and
idea.
try to not talk. But yeah, like, so maybe, and again, lymphatic, I guess I'm just thinking that like when you have any kind of like intrusion in your body, the lymph system is going to be heightened.
Totally. I
So
feel like it goes in like to protective mode and things start to, swell up a
right,
little bit to protect you.
right.
Yeah. Holds on
So
to the
that's my
fluids.
plan. But I feel like that's something that I'm really going to try to focus on as I'm doing this is to dress the whole body too, because there's so much to that,
I
as
need
you
to.
know. But yeah,
I need
yes,
to. Yeah. I feel like so like I've had some massages and some body work and stuff like in the past couple of months. I've not been doing cranio, like I have not been to
CFT.
uh CFT, CST or chiro or anything lately. But there is somebody who does the craniosacral work here that's like highly recommended. So I need to call her and see if like I can get in with her. The other thing, I'm not allowed to work out for a week because of the suture line cut.
Sure.
So I also was like, am I going to be allowed? Like, is it a good idea to like lay face down on like a massage bed? I don't know. I need to ask her. So I might like go message her after we wrap
Yeah.
up so I know if I can like what I can schedule even
Sure.
because I'm sure it'll be fine to like lay on my back, but I'm like to lay on my like
Right.
with face down. I'm like, would that put pressure on anything that might not be a good idea? I don't know.
Right.
I'm like, if they don't want me doing Pilates for a week, like, can I
Right.
lay face down? Who knows?
That's a good
So
question. I hadn't thought about that. The lymphatic massage place that I go to, and I don't know if this is the same for all places, but they do a lot of it when your back is like you're facing up. So I
yeah,
wonder if that's maybe even an accommodation that I'll make for the.
probably. I'm sure that they could definitely accommodate.
But
Yeah.
that's a good point. Like I wonder if laying down would be negative or not something that's optimal.
I mean, I
Um,
think for you it's probably totally fine because you're splitting the suture
sure.
yourself.
Yes,
I
yes.
think it's just because I'm having it split for me. Like,
Yeah.
part of me is like, I just want to get everything cleared. You know what I mean? Like, if she's like, oh, yeah, no problem, like, you're good.
Yeah.
Or like, oh, that might be too much like pressure on the facial bones because your face is literally like in that circle thing. And I always feel like it's uncomfortable. So,
I'm glad to hear that because I always feel that too. I'm like, it's just never like perfect, right?
and
Um,
depending on the place where I go, I sometimes wake up with like the line on my forehead that stays for 7 hours. And my husband's like, are you really going to go in public like that? I'm like, well, what else am I going to do? Like,
I can't
yeah.
do anything, but it felt really good.
Exactly.
Time.
Oh my
Uh,
gosh. Yeah. Is there anything else that you're doing or?
so no, like those are the main things. Like I am going to try to like focus on the body work piece, doing craniosacral fascial. I do have a PT that I work with who's PRI trained.
Yeah.
So I'm going to be working with her throughout the journey. I am trying to do all the things. I feel like as we learn more, we always learn more. And then it's going to be like, oh, I should have done this. But
Yeah.
I think those are going to be the big things. Like, I mean, I'm trusting the process. I'm trusting my ortho. And then I'm really excited just for the more space. But I think those are the kind of the big things that I'm, yeah.
Exciting. How frequently do you think you'll be doing like the different types of body work?
So right after, I am getting that massage the day after. I'm planning on doing some kind of body work, something while I'm turning it weekly. So I'm
Mhm.
planning on doing that. I'm going to up my chiropractic, I think twice a week while I'm doing it because those adjustments are so quick.
Mhm.
Um, and then as it's just sitting in there and I'm healing, I don't know if I'll do weekly. I might space it out some more, like, but I have not come up with like a protocol exactly on that yet. But
Okay.
so TBD, but
Yeah, I want to like go. I want to go message them and ask them about like, face down. Do you guys have any suggested protocols for body work? Like, is that something you're gonna give me next week? I don't know. So yeah,
this is
yeah,
one of those things in this airway space that I think we're learning more and more about, just like how much it all is connected. I mean, like I know
totally.
down to your feet, down to your hips, like all of it is related. So like if we're shifting this bone, how else is it going to impact the other parts of the body, and how can we keep it in alignment and keep it optimally functioning, especially when we're doing like such delicate things in this area.
Hmm.
But
Yeah,
so I'm kind of using myself as a case study, I guess, because there's not a protocol for it. Like there's
right.
not like, oh, you need to do this because of this and this study, or like these thousands of people that have been through it before. I mean, Marpe is, I feel like, how new is it? I feel like it's fairly new, like not,
I don't even know. Let me see. Let me see if I can get a quick answer on that.
yeah, but all that to say, like I don't feel like it's something that's like widely talked about or studied, but I
Yeah.
think it's going to have, yeah,
Yeah, because I mean, expansion's been around for a while, but as far as
for
Marpe
sure.
goes,
But Marpe,
um,
yeah,
early 2000s.
okay.
Yeah, it says initial studies on bone-borne RPE began in South Korea and the US. Dr. Won Moon at UCLA becomes one of the pioneers in clinical development of Marpe. Mid 2000s to 2010s, widespread research in skeletal expansion in non growing patients, clinical protocols, CBCT image studies validate its effectiveness. 2010 to present, Marpe gains global adoption as a minimally invasive alternative to SARPE and particularly used for adults 16 to 40s with transverse maxillary deficiency. Well, we just snuck right in there, didn't we?
We did, right?
Yeah, so it's only about like 20 years old with the like mainstream clinical adoption in the last 10 to 15 years.
Yep. So
Yeah.
interesting.
Yeah, I know, which is also like, I'm like, it still feels so new. I can't believe I'm doing this to myself. But no, it's going to be great. It's going to be great. And I think the body work thing. So like when I did my DNA Vivos appliance, which was removable and I only wore it like 8 hours a day, I was supposed to wear like 14 to 16. And I was like, I can't talk with an upper and lower appliance in my mouth. Like it was
Right.
so bulky. So like, that's why I'm like, this will be interesting. But that literally, because it had the metal and the like plastic components of it, like gave very little space for my tongue. Like I could barely move my tongue with it in. So I'm like, this, I feel like I'll have at least a little bit more space, even though it'll be weird space. Um, but they had the dentist that I was seeing in Maryland had a PRI trained PT, actually two of them, like that came into the office one day a week each. And so they would work on the patient. So they would like schedule you for adjustments or check-in appointments on the days when like they were in. And then you would also have like an adjustment with them in office as part of the treatment plan, which was really cool. And then if you wanted to see them in between your appointments in office, you could go book, individually and pay for that separately, which is what I did. And so I worked with a PT who was PRI trained as well. And he used like manual counter strain technique. And he said it was like more of a modern counter strain technique, I guess, not the typical counter strain that people know. And it was very interesting because I feel like he worked on the lymphatic system. It was like, reminded me a little bit of some craniosacral fascial technique, like
Yeah.
he would do the brain mapping. He would go, it was just amazing. And so I'm like, I feel like I need something like that again. I just don't know who that person is here in Boca. So like, get on it, Hallie. It's time to figure that out. We only
Yeah.
have like a week and a half to go.
That's, yeah. Well, I hope you do find someone because I think that'll be just like helpful. Because especially with the jaw, like, because that's what it, is going to be manipulating so much. And when you're talking so much, I feel like it'll be nice to just a little addition. But that's great that you did it before. So like you did so many things with Vivos.
Mm-hmm.
So yeah.
Yeah. Yeah. So I'm like, and I know like my palate would kind of feel like it was locked up. Like I couldn't turn the key and put it in. It just physically wouldn't let me like put it in at certain points unless I had my body adjusted that day. And so it was really interesting to see like how much easier it was to continue expansion when my
Your
body was like unlocked. You know what I mean?
yeah.
And I feel like it really helped a lot full body, but still my maxilla just like wouldn't give. I'm like, that needs to be like physically split apart from the other side. So here we are.
Oh my gosh,
Ready,
yes.
set, go.
Yes. And then, so Myo related too, what are you doing to help yourself as you're going through it, Myo related? Like what types of exercises, what types of things are you going to be doing?
Honestly, I feel like I live Myo, right? So like, and I can do all the things, and my tongue is up when I'm not sleeping, and right. So
Mhm.
I feel like with Marpe in, until it comes out of my palate, I'm not going to do anything with Myo because my tongue can't go up to my palate. So it feels very compensatory until that point. So I think I'm going to be more focused on making sure like I maintain my current skills, if anything, and then once like 8 to 10 months in, when the actual like Marpe comes out of my palate, the screws come out and everything, and I'm just in the clear aligners, I will probably like put myself through a
Sure.
round of Myo just to like make sure that with the new tongue space, with the new whatever we're seeing happen, that I am not compensating, because I'm guessing there are still some compensations in place that I may not even be picking up on right now, and until like the palatal shape changes a little bit more and I have a little bit more room. Like we were talking about it, and Dr. Koval was like, the palate does come down in most patients, right? So you actually have less like elevation that your tongue is trying to manage. It's not trying to overcompensate anymore to get higher up. And so sometimes it's actually easier to suction. And so it's like, well, you can even though things become like easier and you have like a different space, I feel like compensations can still happen, even though the
Absolutely.
space is more ideal. So I'm like, that's the one thing I'm a little keyed into, where I'm like, be curious to see like,
Yeah.
does my tongue just automatically go up to the palate? Am I not getting a scalloped tongue anymore? Like, am I, yeah, I don't know. I
Yeah.
don't know. So
Yeah.
Myo's on the table for like after the Marpe is.
Yes.
I keep saying installed and uninstalled, like it's a software. Like once it's uninstalled from my mouth.
Oh, yes. Well, so one thing that I am going to be doing though is some manual work on myself, like intraorally. So like
Mhm.
floor of the mouth, some things with my jaw, like just some of the things like
More like
that.
myofascial release type of stuff, or
Kind of, yes. So, have you heard of Walt Fritz? He's a
Mhm.
PT who
Yep.
teaches SLPs.
Yeah,
Okay,
he spoke once in
amazing.
the membership, actually. Yeah.
That's awesome. He's so good. Maybe that's where I found him, actually, from the membership.
Yeah.
I went to his like full training, but learned a bunch of techniques with like tongue pulling, tongue stretching and twisting. It's not true myofascial because it's not as like intense. It's
Mhm.
more gentle maneuvers. But I'm planning to do some of that and hoping that that'll help with just as it's shifting to help
Yeah.
with how that's sitting in my mouth and working. But you're
Yeah,
right.
I mean, like you talked about, like with the lymphatic system getting like locked up and everything, or, I feel like part of that is just when anything happens, the body kind of goes into this fight or flight. And it's like, what's happening? Why are we doing this? This is not our normal, like, MO. And so I feel like supporting the body through that, but also releasing any tension that you can anywhere, and just kind of relaxing the surrounding muscles and the supporting muscles that are all going to be super interconnected in our orofacial structures, I think will be really, really important. And I know some myofascial like release techniques that I can do like in my mouth with my tongue and stuff like that,
Yeah.
cheeks and everything. But yeah, I hadn't really thought about that too much, but I feel like for me, it'll be more like, ooh, I'm feeling this. Like, let me try this. You know what I mean? Cause yeah.
Yes, I mean it's different when it's us because like we're practitioners, so like we have those tools at our disposal. But I'm also thinking for someone else who's maybe considering this as their journey and they're not like in this, like what else? How can they be supported? Because yes, Myo, obviously a big goal is suctioning and getting it in your palate, but like there's so many more pieces to the muscles and how and when the right time is to do Myo and when to do it all. And there's so
Yeah.
much to it. But I'm just
Yeah, I think that she recommends in her office, because she has a myotherapist in her office, an SLP myotherapist, and so who's in there like maybe a couple days a week, and so she definitely, like, when you do your intake paperwork with her, and you're like, you sign like an agreement and a contract, and you're basically agreeing that you're going to do myo, and that you're going to do X, Y, and Z. And so she from the get-go is very, very big on like that at least that support.
Yes.
And I think for most of her Marpe and appliance cases, it's when the appliance is coming
Comes
out.
out.
And so like my kids, when they get their upper appliance out, they're still going to be in clear aligners for a while. So it's still going to hold that expansion. And that's why I think like she waits to go into myo until the palate is open,
Sure.
because you're holding the expansion. So you don't have the risk of relapse happening because you're going right into that clear aligner. So I think that's the biggest thing that my concern has always been is like, if we pause myo, if you're doing myo and you go into an expansion, like, do we stop? Do we continue? Do we restart once it's out? Do we risk like relapse happening because you're not going to move through myo fast enough to hold your expansion? You know what I mean? It's like all these questions. And so I do feel like she's like kind of thought through some of that. So it's like we maintain the results because we have something holding it while we reopen the palate, which I think is honestly genius. So
It is so genius. Yes. Like, I mean, I think that really makes sense. And that also proves, like, I think we've talked about this too before, but how it's not just the appliance, it's also the practitioner. It's who is doing it, because it's really an art. Like, orthodontics is really an art.
yes.
You have to have the right person doing it. It can't just be everyone can do a Marpe.
Yeah. And she's modified like all of the appliances. So like when I'm like, well, people are asking me what appliance the kids got. I'm like, is it a Haas? Because I show people what it looks like, and they're like, oh, that's a Haas.
Right.
And she's like, well, I mean, it might have like the bones or the idea of a Haas. She's like, but I've modified it in these different ways, so it's not really a Haas anymore. It's like, you want to call it a modified Haas, sure. But she's like, it's accomplishing different things and working differently than your traditional Haas expander. And I'm like, okay, that's the answer then. I don't know. I don't know what else to tell people, like that's what we're doing. And then clear aligners. So
absolutely. No, that's going to be so great for your kids to have clear aligners versus.
Yeah, they have the lower one in already that started when they started their expansion. And so they're actually getting their upper appliance out in August. And so in a couple weeks, they're very excited, and they'll go right into the clear aligners for the upper as well. So
that's amazing. That's really nice.
Yeah. And they're so good. They're like, Mama, it's Tuesday. We have to change our Invisalign. And I'm like, oh my gosh, you're right. And I didn't even realize what day it was. Thank goodness that you're on top of this.
That's amazing. My daughter too, I think she's close to your youngest age. She's almost 7 is my oldest. She just finished her expansion. And she's so good about it too. I'm just like, I'm so impressed by you, how you remember this. Like, she remembers it. She remembers when to turn, we're done turning, but she remembered when to turn. She would like remind me. She's like, hey, it's Tuesday, it's Thursday. We got to turn. And like, it was so good. So
good. I know people don't give kids enough credit, like they they own it.
It'd be so amazing. And I think they get it more than we give them credit for too, like when they're in those appliances, and they're so fortunate too, because I feel like they don't feel the pain that adults feel. So
my kids definitely felt, I think, a little bit of pressure. Like they'd be like, oh, my nose. Like I would turn the key or like whatever. And they'd be like, oh, but then it was like momentary. You know what I mean? It was like 10 seconds later, it was gone. And I do feel like that they felt it a little bit when they were in their other RPE too, but they didn't really voice it the same. So I'm like, I don't know if it's because this one had like the plastic stuff. So it's actually physically pushing the soft tissue with the hard tissue. And whereas before in your traditional RPEs, like it's only like pushing the hard tissue, really. It's not like actually physically touching the soft tissue. So I think that changed like how they felt what was happening a bit more, but yeah, so that was interesting. So I was talking to her about it, and I'm like, well, they mentioned like they could feel like that mid, like facial, shift. It was like momentary. I was like, is that what mine's gonna feel like? And she's like, you're gonna feel some pressure, and then but it'll be fine. Like it shouldn't be painful. I'm like, okay.
I'm so curious about that pressure feeling, because I have heard that from people who have done Marpe, just that like they have this pressure, and I've heard a lot of pressure until the suture split.
Yes.
So I'm curious, like, and this is where we'll have to like compare notes, because I'm curious if I'll have that. I'm guessing I will, and you won't. So like maybe there's like another pro to
because I was asking her about that. I was like, so my friend's having a lot of pressure right now because she's splitting her suture, and I'm like, am I not going to have that? And so her answer kind of sounded like, I'm still going to have some pressure, because I think it's not just about the palate splitting, but at the other surrounding, structures that are impacted by it too. So I do feel like maybe I won't have the same pressure in the same places, but I'll definitely have like that mid facial, like pressure that I think people kind of feel as things are moving.
Yeah.
I was like, that makes sense. I mean, obviously it's going to impact other things too, maybe, but yeah, we'll totally have to compare notes.
Yes, no, we
Yeah.
definitely will. Yeah, it's going to be interesting. And I love the idea of doing like some kind of journal like each day or something,
Yeah.
like a check-in, because it's definitely a big thing to go through when you're
Yeah.
bored.
And I can't remember what the reasoning was, but somebody told me it's actually can be more painful for men than women.
Oh,
So we
interesting.
have that going for us.
Is that though because men just like have a lower tolerance for pain, or
Maybe I don't remember, like it was something,
how can I
biological, physiological that is totally beyond my brain at the moment. But yeah, it was men, I think, feel maybe more pain surrounding it, and women feel and like the pain and the pressure, whereas women, we may just have, our body goes into that mode where it's like, you got this. We're not going to have you feel pain. We're just going to give you a little pressure. I don't know.
I
We'll
mean,
report back and let you know if that's true in a week or 2 weeks.
right? I mean, I'm sure there's going to be something and there's going to be some complaining, but there's got to be something to that, like just like
Oh yeah.
biologically, like maybe we're just like made for more pain, like we can just tolerate more, or, I don't know, but that's too
Yeah.
bad. I wonder what the percentage is for men versus women going into this and like choosing this as their like health journey.
Yeah, I have no idea. I feel like every time she's like Marpe day, like I'm like looking at, and she doesn't always put the patient's like full face. It's like just their mouth, but you can tell if it's like a woman or a man, sometimes. And I'm like, there's been a couple men recently that have gotten it put in, so I'm like, okay, this
Yeah.
is interesting.
Right.
Yeah, I think that I don't know. We'll have to see, but I think it may have been something hormonal too, with like the whole like pain tolerance and response.
Interesting. I
I know
wonder
my another friend's husband, who's an SLP, is in Marpe now, and she said it was like really painful for him in the very beginning, and but she's not had like other women like report the same level of pain as her husband did, and I'm like,
interesting.
I don't know, maybe men are just wimps. So I'm sorry if there's any men listening, but you guys like sneeze and you're like, I'm dying. So there's that.
Do you know which one always cracks me up is there's a reel, and maybe this is more because I'm also a birth doula, and so I feel like it's maybe more in the birth space, but there's this reel that goes around that's like they've done studies that like the human body can only withstand X amount of pain, but during childbirth it's X amount of pain. And I'm like, did they do the initial study on men? Because clearly women can sustain more more pain.
Right.
That's what the standard is, like, and
Yeah.
childbirth is like 10 times that amount or whatever. But I don't know, just my my own theory. But it always cracks me up with that stuff because pain is such a hard thing to measure from person to person.
Very true. It
But
is so subjective.
and I wonder how, like, even so on women though, like in health, even like because I know that there's some studies with this, like with sleep apnea, like more men are diagnosed with sleep apnea, but women still have the symptoms of sleep apnea, but we just don't have as many apneic events.
Yes.
But we're not getting that like quality deep sleep the same way. So I'm wondering, like, even like with hormonal shifts, like throughout the month, if that changes things too.
Maybe.
Or even as we're doing this, like I wonder if like during different points in the cycle, if we'll have more pain. I don't know. Maybe
That's
that's
interesting. Yeah. I mean, I guess that would be interesting to track too, is like where you are in your cycle, like what your pain level is each day. Obviously, I feel like it's subjective, but I feel like through something like that on a day-to-day basis and matching it with your cycle month after month, like while this is in your mouth for at least 8 to 10 months, right? I feel like you probably can see some kind of a pattern based on like where your cycle is in the month. So that could be fascinating. Okay, well now, Jeannie, we need to just create an entire like cycle calendar and then a pain level. I mean, we have a lot of work to do in the next 10 days.
There's a lot of work. But is it only 10 days? Gosh, that's a
11 days. I don't know. It's like we're recording this on July 31st. This won't go out for a couple of months. So people are going to hear this like after it's in our mouth. So now go follow us and check in on how we're doing, because this will go out, I don't know, I think middle of October maybe. And so by that point, yeah, we will be into the appliances. So you guys are getting like the front end discussion, and you'll be able to have a back end discussion too pretty quickly. But yeah, I think that'll be interesting because there's definitely like cyclical like sensitivities and fatigue and hormonal changes that change your response to pain and all that. Totally.
Absolutely. Well, and then the aesthetics though, like I think by October we're both going to look different. Like I feel like there will be
yeah.
like, and we'll obviously notice them more than anybody else, but I feel like Hopefully, I'm praying that your nose stays the same, and I'm praying mine drastically changes. So.
Well, it's interesting because she said she's got a patient right now who did not want her nose to change because she's also had a nose surgery before, like a rhinoplasty, and she's getting married soon. So she was like, and the person's not even local. So like she was coming a lot more, I think, to like monitor, like, how she's doing. And so Dr. Fall is like, I will check in with you a lot to me. I mean, I'm 10 minutes away from her office, but she's like, we will monitor you more closely to make sure that like things are not like shifting away from where you want them to be. But I feel like I'd be more nervous if I needed like 10 millimeters of expansion. I'd be like, there's no way my nose is not going to change. Like, absolutely no way. I'm excited for you because if you can avoid like a septoplasty or like, I don't know if your turbinates are enlarged or any of that, like as you open your airway, I feel like if you can avoid that nasal surgery, like how freaking cool will that be?
That would be so cool. That's definitely the hope. Like, I really hope that it can help with like just nasal breathing is really like a big goal, is like just that nasal breathing would be easy and effortless, and that I just have more room in my mouth, in my nose.
Well, I'm excited. So here we go. All right. This has been amazing. I know we could talk like all day, every day, but we'll do a follow-up on this once we both have like relatively clear speech and we can, come back and record on how things are going.
You don't want to do it with broken speech? That'd be really fun for everyone to hear.
Yeah. Hey, we can plan to do one in the middle of August. That'll be fun.
Oh gosh.
No one will understand what we're saying. It might be a little slushy, but it's fine.
Oh gosh. Maybe just a phone call so we can compare how awful we sound.
Totally. Yes. We will have to like phone call, FaceTime, that way we can see the facial cues when we're speaking. Maybe we'll understand each other better.
Yeah. So it's been so great though. Thanks for having me on. And I really hope that this reaches people who are maybe considering it, because it's going to be a good drastic change. So awesome.
Yeah. So where can everybody find you if they want to follow your journey?
Yeah, so I'm going to be documenting it all on Instagram. So my handle is the best Mayo. It's not because I think I'm the best. I mean, there's some of that, but it stands for Breathe, Eat, Sleep, Talk. So my website is that as well. So thebestmayo.com. But also Breathe, Eat, Sleep, Talk is my business name. So that's where to find me.
Yeah. Thank you so much for joining me.
Thank you for having me. Have a good one.
Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Thanks for listening to this podcast. If you found value in this episode and want to hear more of these Myotots, Airway, and feeding related episodes, be sure to leave a review on Apple Podcasts and share this episode on your social media platforms. You can access free resources and all I offer at HallieBulkin.com or pop over to @HallieBulkin on Instagram to get all the latest updates.